Welcome back to PsychologyWorks. I'm Dr. Greenaway, your host. Today we're going to be talking about a disorder that has a lot of mystery around it. Almost everyone's heard about it. Most people misunderstand it, or they're not sure what exactly it is, but they know a little bit about it. And that is dissociative identity disorder, otherwise known as DID, previously referred to as multiple personality disorder. So let's get into this. So the technical term for it is dissociative identity disorder. And a lot of the information that I'm going to be giving you today comes out of this fancy book right here. It's the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It started out as a small pamphlet in the 1950s. It's gradually grown over the years, so now we've got something like this. We've got a smaller version of it too. Here's the small compendium of all the disorders, but I'm going to use this one because it gives a lot more information. So dissociative identity disorder, it actually only has 5 criteria, and really we can narrow it down to 2. So let's first define specifically what it is, and then we can go into a little bit more of how prevalent it is, what would it look like if you saw it in somebody, or how do you tell if you might have it. Well, first of all, let me tell you, the chances are extremely low that you would have it. First, you've got this disruption in identity. Now, the way it's worded, I'll try to read over it quickly, then I'll explain what it means. But for those of you interested to hear the jargon, here we go. Disruption of identity characterized by 2 or more distinct personality states, which may be described in some cultures as an experience of possession. We're going to get into that in a minute, this idea of appearing to be a possession of some sort, which it's not. But like I said, I'm going to explain that in a minute. The disruption in identity involves marked discontinuity in the sense of self and sense of agency. Basically, a sense of agency means that you feel like you're in control of yourself. If you think to yourself, I want to go make a sandwich, and you go and you make a sandwich, you feel like you're controlling your body and you're making a sandwich. If you were lacking a sense of agency, it would almost feel to you as if you're just watching this body doing it on its own. It's a sense of depersonalization. You feel like you're not really yourself. Even I have trouble kind of comprehending what that would be like, because I've never experienced it, and I don't know what that would seem like, to be doing something or talking or engaged in some task, and then it feeling like I'm more observing someone else doing it. So we call that depersonalization. There can be alterations in pretty much everything that makes up how you see yourself as your personality would feel like it's not really you. These signs and symptoms may be observed by others, or the person themselves may be aware of it. So a lot of people think that if you have DID that you're unaware that it's happening, but it could be that way, but it's also possible for the person to be aware of it. Let's talk about this word possession that I used earlier. You can divide DID into 2 general camps. You've got the possession form. These are the kinds that we think of when we think of the movie Sybil or the 3 Faces of Eve, where the person is talking in a different voice, different accent. Maybe they're talking like a little child and saying things that a kid would say. Other times it may appear as if the person was taken over by a demon or a deity. Now, to be clear, neither of them is actually being possessed. It's just the way it appears. So what we call the possession form in DID typically manifests as behaviors that appear as if a spirit or a supernatural being or some outside person has taken control. The other type, the non-possession form, would just be where the person sort of has a sense that they're not in control of what they're saying and doing, and that they're sort of on automatic. Criterion B is about memory. There has to be these gaps in memory. The way they word it is recurrent gaps in the recall of everyday events could be important personal information, and or it could be some traumatic event from the past that's being blocked out. And the memory problem has to be really inconsistent with just normal forgetting. So it could be where the person forgets important events in their life. If it was a woman who had given birth and she can't remember that event, or the death of a loved one, or something that most people obviously would remember. Another strange gap in memory with DID is what we call a fugue state. So there's a great word for you, F-U-G-U-E. All of a sudden the person will be aware that they're somewhere and they have no idea how they got there. So they might be at the grocery store all of a sudden, or they might be at a different location in the house, or they just suddenly realize they're in the closet. They have no memory of going into the closet to get there. The person may also find things that they know they must have done something. They find evidence that they did something. So for example, they find writing that they did, or a drawing that they know they did because it's their style of drawing, but they have no memory of doing it. Or there's items in their grocery cart that they don't recall just putting in there. Then you've got three other criteria. Let's take a short break. This is the part where I beg you to please click like, subscribe if you want to see more videos like this. I took a break for a while. I was working on a book. The book's finished. It's in the publisher's hands. It's for clinicians. It's teaching clinicians all the different strategies for treating different disorders. But the main point is that I have more time now. I'm going to be making more videos. So click subscribe, click like, and let's get back on with the show. We've gone over the two primary criteria. Then you've got three other criteria. DID has to cause clinically significant distress or impair your functioning. Culture plays a big role in this. So what the DSM-5 says is that many features of DID can be influenced by the individual's cultural background. If it's considered normal in that social setting or in that culture, then it would not be considered a disorder. And then you might ask, where is this normal? And the answer is, for example, rural areas in the developing world, also among certain forms of religious groups in the United States and Europe. The last one is, if you only have the symptoms of DID when you're under the influence of drugs or alcohol, then it's not considered DID, it's considered a manifestation of the substance use. A big question that people want answered is, who's susceptible to getting DID? Who can get it? Can anyone get it? Well, there's two parts to it, and this goes for mostly every disorder. Usually, you have to be kind of predisposed to it. Your brain's wired in such a way where you maybe would have a higher likelihood of getting it, but you still may not. It has to be paired with certain events. So the way it's worded in the DSM-5 is that DID is associated. It's not totally caused by this, but it's associated with overwhelming experiences, traumatic events, and or abuse occurring in childhood. They even give a percentage here. The prevalence of childhood abuse and neglect in the United States, Canada, and Europe among those with the disorder is about 90%. It doesn't mean that 90% of people who are abused will go on to have dissociative identity disorder. It means that if you look at the people with dissociative identity disorder, 90% of them have experienced some sort of childhood abuse or neglect. But there's also a wide range of people who have experienced abuse that do not go on to have DID. So sometimes that can be a little bit confusing. So rewind and listen to it again if it didn't make complete sense. Maybe draw a little diagram or a model to help understand it. I said earlier that it's pretty rare to have. There was only one study. They looked at a small United States community. In a 12-month period, they recorded how many people had DID, and it was 1.5% of the population. Because DID is so rare, you got to consider whether this is factitious disorder or malingering. Now, malingering is when a person pretends to have a disorder to get some secondary gain. They want to collect disability, or perhaps they've done something wrong, so they start acting like they have multiple personalities, a good one and a bad one, so that they can blame the bad one for having robbed the bank So they're just faking it to get some kind of gain, and it's a hoax. Factitious disorder is a little bit more disturbing. That one is where the person is still faking it, but the only gain they're getting is to be the patient. They're getting attention, people care about them, they're maybe fitting in with their social group or something like that. And so the person says that they have DID to gain that kind of attention. A lot of times you can tell that by the fact that the person only has symptoms that are on the news and that everybody knows about, but they don't have the less known symptoms, because, you know, if they're faking it, they only can fake the ones that they know about. So there you have it. Hopefully after this video you know a little bit more about DID. It's an interesting topic. A lot of people are talking about it on the internet. There's even apps, dissociative identity disorder apps. So I just thought it would be helpful to have a video explaining a little bit what it is from an actual clinical perspective from a professional. Well, this is Dr. Greenaway signing off, and we will see you in the next video. Take care and have a good one.